Everything's okay. Good afternoon, I should say. It is February 29th, leap year 2024. I'm Dr. Deuk Majan. I'm here with my team at Deuk Spine. And our patient is here from Texas. He is here because he has back pain. He is suffering with back pain for many years. And in particular, he has a disc herniation or annular tear at L4-5. We're going to give him some numbing medicine shot. Okay, looking good. Shot. So his back pain, it turns out, is coming from two things. The disc, L4-5, annular tear, and facet joints. He has facet joint arthropathy. So we're going to fix both today. Now the facet joints, the way we fix it here at Deuk Spine, we stopped doing medial branch blocks and RFAs because, to be quite honest with you, they never last. And we don't like doing treatments that don't last. We like doing treatments that actually last, that are durable, that people can come and have done and then be done with it. They don't have that problem come back. And the biggest problem with facet pain is that the rhizotomy procedure that everybody does, it just doesn't last. So patients end up coming back, they're in pain, and they need another treatment done. AP. At this point, you can see on the x-ray the sacrum, L5, L4. We're going for the L4-5 disc. Everybody agree? Left L4-5, Deuk laser disc repair? And there it is. Our patient definitely has osteopenia, if not osteoporosis. I can tell based on his x-ray. All right. Yeah, these are not normal bone mineralization. I am wearing my glasses, but I can tell you there's something wrong with this bone density. All right. Shot. Is he awake? We're ready.
How are you doing, my friend? You okay? Hi. Can you open your eyes? You're doing great. We're going to ask you some questions now, okay? Keep your head still. Please keep your head still.
When I asked him where his pain was coming from the worst, this was the area right here. Turns out on the MRI and in his body, he's got a disc right here. It's called L4-5. It's the number 4-5 disc, located between the L4 vertebral body and the L5 vertebral body below. Most common disc to be affected, causing back pain, L4-5. Next most common, L5-S1. Third most common, L3-4. By the way, back pain, like his, 87% of all chronic back pain comes from a damaged disc. 87%. 8% comes from the facet joints. All right, together they make up 95%. So 95% of chronic back pain is disc facet. That leaves 5%. So what is the other 5%? 5% of back pain comes from things like the piriformis, muscle being injured, which he does not have, and the sacroiliac joint, and fractures. Fractures account for about 0.5%. Okay, is he ready?
My friend, can you open your eyes?
Are you comfy?
Are you comfortable? He said yes.
Any pain?
Any pain right now?
How bad is that on a scale of 1 to 10? How high?
What number?
How high does it go?
8.
Is that where you get your back pain? Is that where you get your back pain, typically? All right, we got 8 out of 10, concordant. When you wake up, that pain will be gone along with your facet pain. Count from 1 to 100 out loud so I can hear you. Shot. All right, at this point, we know. Jordan, show us on the x-ray where the tear is that's causing his pain. Can you guys see the tear? It's beautiful.
Yes, we can.
Right there. Show us the center of the disc, Jordan, where we injected the dye. Circle it. It's much bigger than that, Jordan. It's that whole black area. Yeah. Now show us where the tear starts. Yes, and where it ends. Yes. A little further. There. So that tear is around 2.5, 3 centimeters long. That's what we're here to fix. That's where his pain is coming from. I can tell you this. He is a doctor of chiropractic. That's all I can say. So, chiropractors do get fixed too. They don't like to have surgery, but sometimes they need it. Sometimes everybody needs a little surgery. Henry,
Sir.
will you show our audience how is it that a disc problem can cause so much pain? Okay, welcome back. Now, we've lost our x-ray feed for you guys, but I can still see the x-ray. So I apologize. You may not be able to see the x-ray, but you can watch from the eye in the sky. And let me have this. We're advancing the tube into the disc. Now, his pain is coming from this tear right here at L4-5. That should be good. Shot? Perfect. We've just placed this tube into the tear. And I'm putting a little pressure. He seems to be on some type of a medication or supplement that is making him bleed a little bit. It's not much, it's just a little bit, but it does have an antiplatelet effect that is impairing his platelet function. It's not bad, it's very mild. So we're going to get the scope ready. Hold this, a little pressure. And let me just take a look. I probably just need the laser fiber. All right. I need this light here. Move, please, doctor. That's blocking my view. All right. We are now in the scope, and we're going to start removing the herniation pieces at L4-5 on the left side. Any questions from the audience?
At this moment, no current questions.
Let's show the audience then our new video showing how the Deuk laser disc repair works. All right, welcome back. And
Patient is not orthostatic.
not.
We just checked.
So they must be resuscitated.
Yeah, just 3 liters with 40 cc's of blood loss.
Hey, listen, I agree.
That's not.
But you give me 3 liters, I'd be peeing like a racehorse. I guarantee you that. Probably. All right, welcome back. We're just talking about one of our other patients, our fusion that we did earlier today. And everything is going well. Unfortunately, fusion surgery is very painful. The recovery is long and very painful. And that's even with my fusions. Patients will have pain. With laser surgery, there's minimal pain. I mean, we're talking Tylenol pain. All right, that said, we are at L4-5. Everything is going very well. We are inside the annular tear. You can see it right there. And I am removing the herniation stuck in the tear. I'm trying to get the focus a little better for you guys, and I don't know how much of this is focus versus blue dye. That's probably as good as I'm going to get it. So when you inject blue dye in the disc, it leaks out during the surgery, and it kind of creates a hazy appearance. The other thing that does that is blood. There's no blood because you can see there's no bleeding, but this is the blue dye. We're able to put a lot in there. Now, when I tested this disc just a few minutes ago, the patient was awake, and he said, ow, that is where I get my pain every day. It's concordant. And it was an 8 out of 10, meaning that it was pretty darn bad. He's a pretty tough guy, I will tell you that. So if he says 8 out of 10, you better believe it's painful. He is sleeping now as we fix his disc. After I do this, we're going to move on to fixing his facet joints with the Deuk plasma rhizotomy. Now, I'll tell you this story because the patient here can appreciate it. There was a time, a long time ago, 30 years ago, when chiropractors would treat patients with stiff, painful joints, and they would do a procedure called manipulation under anesthesia. I know this because my sister is a chiropractor. And what happens in manipulation under anesthesia, actually what happens with any joint problem that has arthritis, is the joint hurts because it's been injured and there's inflammation in the joint, and that's where the pain comes from. But with the inflammation, there's also scar tissue. And it's the scar tissue that forms, that makes things worse, because the scar tissue holds the 2 bones together, and if you start moving that joint, it rips the scar tissue that's there from the inflammation. And that creates more pain and more stiffness. So chiropractors would take patients to a hospital operating room, usually late at night or early in the morning when the surgeons weren't there, and they would put the patient to sleep with anesthesia, and they would crack their back or crack their knee or crack their hip. And what they were cracking was they were ripping scar tissue in the joint. And it's because it's so painful, they would do it while the patient was asleep. You can't do it otherwise. The patient won't let you. They will guard, G-U-A-R-D. They will block you from moving that painful joint. They don't let the doctor move it. Their muscles are much stronger than the doctor, and the doctor only has so much strength. He can't overcome the patient's resistance of their mind and their muscles. So to do that, they would take the patients to surgery, basically, where they wouldn't cut them open, they would just put them to sleep. And they called that manipulation under anesthesia. You did? I didn't know you did those. And Dr. Berndes tells me he used to do them. And to be honest, they work quite well, you know. They work quite well. And they give people good relief for a period of time, could be 6 months, a year. But what you're really doing is you're eliminating the patient's guarding, which allows the doctor, the chiropractor, to fully mobilize the joint that is full of arthritis and scar tissue without the patient stopping them. That's really what you're achieving. So by doing what we do with the facet joints, we're denervating the joint. We're basically anesthetizing the joint, but permanently, by getting rid of the pain nerve, so that the patient can then do their own therapy to the joint. Essentially, the patient will start to use the joint normally after it's been denervated with the Deuk plasma rhizotomy. So there's no need for invasive surgeries. It's all done with a 4 mm incision, and we're going to be doing that next. I've got 5 minutes max left here, and then we're going to go to the Deuk plasma rhizotomy, bilateral L3-4, L4-5, L5-S1. Any questions?
No current questions. We just have a comment from Wilhelm on YouTube
Hello, Wilhelm.
saying thank you for explaining instead of just a Band-Aid. Oh, I think they're trying to develop a question at the moment, and they're still in development. But they just said thank you for explaining for right now.
Oh, you're welcome. My pleasure. I enjoy teaching. I always have. I use these opportunities to teach. Is there any questions?
None, no current questions at the moment. I believe Wilhelm is currently making one, but I'll let you know if it pops
All
up.
right. We got about 2 minutes left, and we're going to end this broadcast, and then we're going to bring you back for the Deuk plasma rhizotomy performed here at Deuk Spine Institute, created here by Deuk Spine Institute. It is now patented technology, and we're the only ones in the world that do it. It is a permanent treatment for facet pain, not an RFA, which is temporary, but it's a permanent treatment. And if you have back pain, neck pain, and it's coming from your facet joints, and you're not happy with the treatment you've gotten, come see us here at Deuk Spine. We can help you. We have a free MRI review. It's free for everybody. We do these MRI reviews 2 days a week, and I'll typically see patients all over the world, right there on Zoom. And we can make a diagnosis. What's causing your pain? That's the most important thing. There are very few doctors in the world that can diagnose pain. What causes it? Deuk Spine is a world leader in diagnosing back and neck pain. And of course, we're a world leader in treating it with laser surgery, plasma surgery, minimally invasive treatments. Hey, Henry,
Yes, sir.
will you take the fusion surgery and send me and by email the link for the fusion?
Not a problem.
Because I want to show a friend the artificial disc that she had that was popping out.
Copy that. Not a problem. And we also have a question.
Yep.
Yes.
Last one because we're just about done here.
Perfect. No problem. This comes from Kieran on YouTube
Kieran?
asking, is there any probability of a CSF leak in a lumbar disc?
I don't know what you're asking, Kieran. Are you asking if I can cause a CSF leak during surgery? Or if a herniation can cause a CSF leak?
I think they mean that. Just like, is there any probability in general of a CSF leak in a lumbar disc?
No, laser. Yeah, I think there's no possibility, no. If you have a disc that herniates and you're asking, can the herniation cause a CSF leak? No. The herniation can never, ever, ever cause a CSF leak. I have never seen it, and I never will see it because it doesn't happen. That's like asking if your dog could play Mozart on the piano. I mean, like an entire Mozart concerto, not just a few keys or strokes. You okay?
Yeah,
You in pain?
I'm just resting a little bit.
No
Balance my
problem.
body a little.
All right, this should be it right here. I'm pretty much done. Let's take a look. There's the nerve. Actually, there's a tiny little piece right there let's get that. I think we're a bit overexposed, but it's fine. It's fine at this point. Thank you. Thank you, Luis. Yeah, we're done. Great job, everybody. So we're done here at L4-5. We're going to do the DPR next on his facets.